Motherhood has special significance for all Christians, and in particular Christian obstetricians, who practice the most privileged of specialties, since it was through a motherhood that the most important event in human history, the Incarnation, took place. The Father chose a woman for a unique mission in the history of salvation, that of being the mother of the long-awaited Saviour. The Virgin Mother responded with complete openness. It was in my early undergraduate medical training in London, England, that I chose to specialise in obstetrics. As I was being called to serve the co-creators of human life, especially when life-threatening complications for mother or baby or both occur. When I began obstetric residency training back in 1968, we were told that an obstetrician had one objective: to ensure to the best of his or her ability that all pregnancies should result in a live, healthy baby and a live, healthy mother. For mothers, this was usually the case, as maternal deaths were rare events, but not so for the unborn child, as the technology and experience was not available to care for very small babies. We were well trained in special skills, for example, cesarean section, forceps, vacuum procedures, breech and twin deliveries, and we had extra training in internal medicine, as women with medical complications such as diabetes, epilepsy, heart and kidney diseases could successfully become mothers, albeit with a lot of extra help. At the same time, it was made clear that there were at least 2 patients present during each pregnancy, occasionally even more. As this quote from Williams Obstetrics at that time stated, "Happily, we live and work in an era in which the fetus is established as our second patient, with many rights and privileges comparable to those previously achieved only after birth. Obviously, the mother is a patient from whom a history can be obtained. She can be examined, investigated, and treated as necessary. Movements of the baby can be felt first by the mother, usually around the 16 to 18 week. This is termed quickening. I've often thought that the feast of the visitation, when Elizabeth, on hearing Mary's greeting, felt her unborn child, the future John the Baptist, leap for joy in her womb, should be renamed the Feast of Quickening, as it is a joyous time for every mother as she bonds with her baby. However, 40 years ago, the baby was more remote inside the mother's womb. It could be felt, its growth and weight measured, its position and the presenting part palpated, and heartbeat assessed at various important times during the pregnancy and labour. However, all of this was done through the maternal abdomen, and while providing a considerable amount of information, the unborn child was still not a treatable patient in the same way as the mother. However, significant developments in fetal assessment technologies were taking place. Ultrasound, amniocentesis, intrauterine blood transfusion, and fetal monitoring were being introduced. Since those days, the new subspecialty of fetal maternal medicine has been introduced so that the unborn child is truly the second patient. Sadly, in those days also, no one anticipated the dark changes that were about to occur in obstetrical practice with the passage of abortion legislation, which would turn the practice of obstetrics upside down. For many, the result had profound ethical, moral, and practical significance, which would have serious effect on their careers and families. The Western world accepted abortion as an easy solution for social and economic problems, with the result that millions of unborn children have been destroyed, as these societies seem to have nothing better to offer other than death and despair. Today, many national health services require all obstetricians to provide abortion services, such that the legal safeguard which protected conscientious objection is currently under threat. There is a centuries-old devotion known as the 7 Sorrows of Mary, which include events in the life and death of her son. Mary was the complete mother and gave total and unconditional love to her son and shared intimately in his life and death. Mary is mother to us all, and thus an 8th sorrow might be added. the suffering of so many mothers who die giving birth to new life, or the millions who, often in despair, destroy their unborn babies.